All right, you guys, time for your health check. And today we are diving into your questions about COVID-19. Our first one is from Joe via email. If someone has had pneumonia in the past or struggles with even a common cold, does that mean they're at an elevated risk or would have a worse outcome like hospitalization if they contract COVID-19? That is a great question, Joe. Here's the answer from Dr. John Carlo, who says people with chronic lung disease or moderate to severe asthma are considered high risk. Now, the CDC recommends keeping these conditions under control as much as possible in order to really limit your risk of a severe coronavirus infection. If you've had recent acute pneumonia infection, that is not specifically mentioned as something known to be a risk factor, but there could be some risk while the lungs are recovering. So really, it's best to talk to your doctor to see if there are any specific treatments or maybe guidance that he or she may have for you. All right, our second question is from Raquel, and I love this one. It's via Instagram. She says, I purchased flowers last week and my husband didn't want me to put them out. He was afraid that with all the people that pass through the stores, someone may have coughed or sneezed and that the flowers could pick it up. And when we go to smell them at home, we could get the virus. So if we buy them, should we disinfect them? How? Okay, I asked 4 doctors about this, Raquel. Bottom line, there's no specific literature on the survival of viruses on flowers and plants. And this is also another case, you guys, for wearing those masks in grocery stores because it does really reduce the amount of viral particles that could spread if you cough or sneeze, right? One more note about this, there's probably not an effective way to disinfect flowers without destroying them. Dr. Anastasia Benson adds, even if respiratory droplets are on those flowers, they're not going to just get redistributed in the air at your house. So while the risk is likely low, maybe just don't get up close and smell the flowers, okay? Enjoy their visual beauty and of course wash your hands with soap and water before and after handling them. All right, our final question this morning is from Danny via Facebook. Have you heard of any COVID-related symptoms being spread by a personal CPAP machine? Great question. Dr. Mark Casanova took this one for us. First, Danny, never share your CPAP machine. That said, a CPAP machine can aerosolize the virus into the air via respiratory droplets. So this is another reason to isolate yourself if you have contracted COVID-19. And you guys, if you have the option, don't even share a bathroom with other people in your house or apartment, okay? That will decrease the risk of others in your household from getting the virus from those aerosolized respiratory droplets. All that said, still there are no reports of coronavirus being spread through the use of CPAP machines. All right, hope that was helpful, you guys. Thank you for sending in those questions. Continue to hit me up via social media and I will answer some more for you next week. All right, for now, let's